welcome to another episode of Rethink Healthcare. I'm Wendy Ball, and this is
Paul Montenegro.
Ooh, more enthusiasm today.
I think we need some music to kind of add into our intros. What do you think?
Oh my goodness, that is an excellent idea.
Should we have like a theme song or something?
Yeah, we should have a theme song.
Like
Music just like helps
drum,
you
just like,
groove.
you know, Taylor Swift has a band. I think we should have a band with us.
Yeah, we should.
Okay, we need to recruit some people.
We're gonna have to rethink that.
Yeah.
Okay, so today we are talking about we need to know our norms so we know our abnorms. And I know at the most basic level for me with my students, because I'm having students that are just starting, and for them to even know their vital sign norms, they need to know because they need to know if something is wrong, if they need to report something, if they need to dig further. So I really emphasize on them knowing those most basic level.
So just to kind of frame it, you're kind of thinking norms is like your basic stuff, like what's normal blood pressure, your heart rate, that stuff. I guess also keep in mind too for pediatrics, the norms are different depending on the age.
Yes.
So that's something to kind of consider. Lab values, I would take that you want. I mean, there's a plethora of lab values out there that you need to know. There's really no way around knowing what the normal values are, really, besides committing it to your memory.
Yes, and a lot of times we talk about in nursing, like, critical thinking, those type of things. But with this, we really do need to memorize some things and just kind of know it.
Yes. If you're looking at, let's say, for lab values' sake, right? I mean, there's always going to be some sort of reference point, right? But you shouldn't just rely on a reference point because you also need to know in heart. Just for example, if the lab calls you and says, "Hey, your patient's potassium's 7," well, you kind of need to know what that means.
I like 7. 7's a good number. Is that not a good number for potassium?
No, their heart will not be too happy with that. What's the potassium norm? Do you remember?
3.5 to 5, but sometimes some labs are a little...
Depending on the lab reference value.
Might be a little...
Exactly. So those...
Quizzing me here.
That's the point what I was trying to make, was that if you know those, and those were committed to us really in school, like lithium level, like 0.8 to 1, right? Or 1.2, something like that.
Something like that.
Wait, no, maybe that was ditch level. I don't remember. I think that's ditch level.
That's why we have reference books.
Yeah. But anyway, so the whole point with that is like, these you have to memorize. There's no way around these things. Now, you also have to keep in mind that when you talk about norms, let's say for like blood pressure or heart rates, right? When you're working with the patient, let's say you have a geriatric patient, their norm may be a little bit outside what the actual normal range is. Someone's norm may be a bit more on the hypotensive side. So you also have to look at history. So you don't necessarily have to be alarmed. I mean, the first thing you look at is, okay, when you get a blood pressure reading, look at your patient. Does the reading match what the patient looks like? Right? So, let's say you get a blood pressure reading of 70/30, but your patient is like
doing cartwheels?
Oh, well, it'd be kind of hard to take blood pressure when they're doing cartwheels, but your patient may be like talking on the phone, sipping on something to eat while you're taking the blood pressure. I mean, the 70/30 in that case doesn't make sense, right?
And I love your point, though. Not only knowing your norms, what the normal, blood pressure value or heart rate value is, but knowing the norm for that patient is so key because sometimes we just assume something. My father-in-law is a little bit of a bigger guy, and sometimes people might assume his blood pressure might be a little higher, and they're surprised when his blood pressure is 98/70. But that's his
normal
norm.
for him.
That's his norm. Yeah. So
and that's what we call what the baseline would be. So that's the patient's baseline.
Yes.
So I guess to kind of tether to that, right? I have a patient who we suspect of having some blood dyscrasias, and her normal potassium level is hovering in the 6s.
Oh.
So clearly it's outside of 3.5 to 5, right? So if it was a new reading, yes, you'll be very concerned. I was very concerned when I first took on the case, but then I looked at the historical lab values for that patient. she was hovering in the 6s for like the past 3 years. She had no cardiac complaints. I mean, the EKG wasn't showing any peak T's. So for her, she was tolerating the higher potassium levels. She didn't want anything done.
Yeah.
What more can I do? I mean, you know. So in those cases, right? Let's say you get a patient and you get that potassium level, and you look at the history. You don't have to be too alarmed. I mean, you need to be alarmed because it's outside the norm, but then you put everything in context. How's the patient doing? What is the history?
Yeah, I always tell my students that, you know, even the machines, the lab values, they're only as good as we are at interpreting them and looking at them. So if a patient's talking to me and they're flat line, they're asystole, I'm not doing CPR on them just because the machine says that and they're talking to me. So we have to be smarter than the machine, smarter than the lab values. Sometimes the lab value could even be off for a reason, right? It could be a false reading on that. Even going back to vitals with my students, like temperature, like you were talking about, as you get older, some of the vital signs change. A lot of times as you get older, your thermoregulation kind of changes a little, and you might have a normally lower temperature. So when I'm looking at that patient and their norm's 97.1 and they have a temp of 99.1, they're probably feeling pretty lousy. As opposed to the patient's that normal value is 98.6 and it's 99.1. So I think that's important to know those norms of that patient, the baseline.
I mean, I think that's the biggest key is knowing what the actual range value is, but then knowing the patient baseline.
Yes, and knowing sometimes it can be off and it's okay, right? Like if my patient's heart rate's 110 and they were just like walking up the steps, you know, I can critically think, well, they were just moving around, you know? I hate doing stuff. But
I mean, I did it quite a bit in some of my home care patients in geriatric primary care. I may have somebody who I'll take their blood pressure reading and it's sky high and tell them, hey, I'm very concerned about this. They're like, look, I was just rushing, you know, can we retake it? I'll be, you know, and let me just sit down, relax, retake it. Okay, fine. You're back within what their baseline was. Still a bit on the hypertensive side, but it was back on their baseline. It changes your outlook and changes what you had to do.
And I love you put in a third kind of thing of like trusting your patients that they know their body most of the time, but it is their body and they kind of know how it reacts. Or your patient with the higher potassium probably could say, my potassium's always high, or this person, my blood pressure's runs high when I'm moving around and all that. So kind of getting that information when we're interviewing our patients.
So once you get the information, and then the important thing too is make sure you do the follow-up. If you get an abnormal reading that you have a concern about that is outside of their baseline, you don't just document that. Okay, they're
potassium 7,
or they're really hypotensive, but they said they felt okay, so I just documented that. I mean, go back again and recheck. You know, how are you doing? Yeah, so that's the important part. As being a nurse, you don't just assess and document, right? If there's something off, you got to follow up.
Yes, that's a great point. I always say if there's anything wrong with your patient, if you document they have dry skin, document what you taught them about that and document that reassessment.
What did you do about what you found? So that's kind of like going with understanding what the norms are to know what the abnormals would be, but also more importantly, right, like as we said, the actual norm values you just got to know and commit it to heart. What do you do about them after that? It's where the critical thinking comes into play.
And I love, like when we were in school, our references were books that we had to go to, and now we have these handy dandy little phones.
Everything's
but you need to know when something's abnormal, because on a lab value it comes up and lets you know usually, but some of the other things, if a blood pressure or something else is off, you have to know it's abnormal to know that there needs to be something to be done.
And don't be afraid. Let's say there's a patient asks you about a lab value. Hey, is this normal? If you don't know, simply, you know what? I'm not sure. Let me check the reference values. I do it all the time. I mean, a patient may come up to me. It's like, hey, this is what it was. It's a lab value I'm not used to reading. Hold on, I'm not too sure. Let me double check.
I
mean, that it's we don't know everything, but the important thing is know where your resource is.
Yeah.
And now, like you said, we have a handy dandy phone that we could do that. Even though before we used to carry the books all the time. Remember that, right?
Yeah.
It's like we don't know we just look at the book. Okay, that's what it was. Same thing with the medications. We always have like a med reference guide. Hey, what side effect do I have to look for? You know.
Yeah.
Now I'm just
Now it's just easy
push
peasy.
it in the computer.
Yeah.
Okay.
Yeah.
Very good. All right.
Okay.
Do you feel normal or abnormal?
Probably usually abnormal. How about you?
Yeah.
Yeah, I think
that's
so.
what my wife and kids always tell me, that I'm
Yeah.
kind of out there and left field.
Yeah. Yeah. My kids tell me that too. My husband always says I'm normal though. Isn't he nice?
Yeah,
Brownie
at
points.
least your husband does. My wife always says I'm out on
Yeah.
somewhere out there in the ether. Anyway, we're out of time. We look forward to our next episode.
Okay. We'll see you later.